So why did we do this? So 2020, right, we all know what happened in 19 and 20. It was the COVID pandemic. We really had a hard time with a lot of our things that were going on. But every year we look at our previous year's scores for all of our quality metrics to determine what we will focus on for the upcoming year. So in 21, when we looked back and saw the scores for 2020, we noticed that there were some areas that we could really improve upon, which is breast cancer, colorectal cancer screening, diabetes, and the annual wellness visit. So using data from 2020, we took a look at all our practices. We have about 150 primary care, and we stratified them, and we picked the 8 lowest scoring practices to work with first. And they were all very happy to be given this extra support. So why did this happen? Why did we see a dip in our quality scores? Well, COVID. Right? COVID really caused many of our patients not to come in for needed care. They delayed treatment. They didn't schedule their appointments. Some did virtual care, but they were really afraid of coming in and contracting COVID. We also see today some lingering effects of COVID. My system is still requiring masking in the practice, right, and screening of patients. And hopefully next week that will be gone when I get back. But we see an increase in patient I'm going to say hostility sometimes. They're really fatigued with what we are asking them to do, and they don't want to wear the mask, and we've seen a rise in incidence in our practices, right? And that makes it really hard. We have inconsistent and varying workflows, and some posters yesterday, addressed that fact. It's very hard to standardize workflows across practices, and our region is large. New Jersey is quite large, and we have 450 practices spread throughout. So getting all that aligned. We have incomplete or inconsistent data collection prior to visits. So lab reports are not collected, tests are not, scanned into the medical chart. Folks don't know where something is, and that really delays our care. So for an example, one of our patients in 2020, she did her Cologuard at home, but the practice never received her result. Next year, she comes in for her physical and realizes the result was never received. The practice did get the result from Exact Sciences, which was good, and thankfully it was negative. But it could have been really bad, right? If it had been positive and we went a whole year without addressing that, that would have been a mess. So we worked with Exact Sciences to eliminate that from happening again. So now we interface with them. So the ordering and the receiving of results is all interfaced. Our the after-visit summary that the patient gets when they leave, if a Cologuard is ordered, there's a QR code they can scan, and it's immediately sent to their house. So we've put a lot of things in place to really address that big gap that we saw. And then team engagement, right? So before the speaker was talking about the CMAs and how to keep them, how to retain them, right? It's so hard, and I'm sure all of you struggle with retention, or even recruiting. Right, as do we in New Jersey, and there's a lot of competition. We have 3 large systems, and our team members just kind of float through each one for 50 cents more, right? And then it's a long time to fill those positions. So we really try to work with our team members to maintain that joy of work, if you will. We're really busy. We see about 30 to 35,000 encounters a week. So our team members are stressed, and sometimes, when staffing is poor, they skip steps, right? Or they make shortcuts, and that can often affect the outcomes. And then finally, patient engagement. As I said, our patients are a little bit nasty right now, some of them, and that makes it hard to involve them in their care because they don't want to do it, right? They just want to do the minimum. At least in New Jersey, where we're from, they're sometimes a little more vocal, and that can be difficult as well, right? So they come into the practice with an attitude, as our team members say, and it's working through all those things, and actually all of those things impact patient care and those open care gaps at the end of the day. So in order to engage our patient engagement, or to engage our patients, we use everything we can think of. That's MyChart. We have websites that are just for our patients. We work with our local hospitals and communities to really educate on what's going on. So this is a question to ponder. You can put it into the chat if you want, but I thought as we go along, as I talk about what we've done, you might want to think about some of the things that you do in your practice. So, what are the things in your area, because every area is different, right, that prevents your patients from following up on needed care, right? So you can think of that just for yourself, or you can type it in, that's fine, but just something to think about as we go through. So why is it important? So you can see the definition here, right? A care gap is when there is a discrepancy between the care recommended and what's actually provided. So these are a couple of examples from our practices. We had a 50-year-old female patient, family history of breast cancer. She did not follow up on her mammograms, and nobody from the practice caught it or followed up on that. We had a patient with diabetes and a really elevated A1C, and he saw multiple providers in our practice, but nobody followed up on that one care gap that was open. So really, you know, those care gaps need to be addressed by everyone in the practice. It really, truly is a team sport. And as you know, care gaps are based on the HEDIS measures, and that, of course, impacts our quality cares. Now, at our organization, we've gone through HRO training, and I don't know if anyone's familiar with being highly reliable, but it's a really good training program. And one of the key tenets of that is to reliably communicate. Right? And we know communication is a major contributor to preventable patient error in the healthcare field. And so we really stress communication. And it's any kind of, it's miscommunication, lack of communication, whatever it is, we think we communicate clearly. Right? I'm probably thinking I'm communicating really well right now, but I might not be. You might not be understanding what I'm trying to say. And for our patients, that's even more critical, because when they're in our exam room, they're not thinking straight, and we're telling them what they need to know. So it's really bridging that gap and making sure we are at their level and understanding what they need. So another tool that we use from HRO is an acronym called STAR, right? And that is Stop, Think, Act, Review. And we ask our team members to do it at every point in the patient encounter. So as they're checking in, right, before you hand a person that piece of paper, stop for 1 second. Is that the right piece of paper to give that patient? Are you giving them the right name band? You know, it gets confusing at the front desk. There's a lot of stuff going on. Phones are ringing, people are interrupting you, multiple folks using the printer, right? So things can happen. When you're in the exam room, before you give that injection, right, stop, 1 second. Did you do the 5 rights of medication administration? Do you have the right med? So simple. We still make those mistakes. So really focusing on that stopping to really make sure that we are doing the right thing for our patients. Now, in this initiative that I'll explain in just a moment, we included our whole team. So besides quality and clinical services, I also have patient experience, I have infection prevention, and clinical education report to me. So I was able to involve all those teams in this project. So for our patient experience team, which is 2 people, we sent them out to the chosen practices, and they actually did some communication refresher training with the team members and with the physician, because it's that important, right, that everyone hears the same message and is on the same page when we're doing this. So we really encouraged our physicians to engage the patient by asking a simple question, because we know patients come in maybe for one thing and then they have 15 things they want to talk about, right? So the patient would come in and the doctor would say, "So, Mr. Jones, I see you here for your back pain today. What else is going on?" So those 2 words, what else, right? And then Mr. Jones might say, "Well, I have a headache, and I have a hangnail, and I have this, and I have that." So by getting Mr. Jones to talk and putting out what he was concerned about, it allowed our physicians to really focus on the 3 top things that they wanted to achieve in that visit, set an agenda with the patient, and then be able to move through the visit quite painlessly, right? Because the patient felt that he was involved and that we are with the patient, not just talking to the patient, right? So our patients really do rely on us to ask questions, or I should say, to answer questions for them that they don't even know that they have, right? And then, of course, there's a lot of money that is involved with these these metrics that the insurance companies put out. So what we do, and in New Jersey, I don't know about the other states but I'm sure they're pretty national, the incentive monies. We work directly with the insurance companies to understand What metrics are they looking for? What are the quality indices that they're using? And then we align them with what our company, what we are looking at.